Dear students, welcome back. Now we are going to discuss about the joint kinematics. The temporomandibular joint is one of the most frequently used and the mobile joints in the body. And the motions available in the TM joint, are opening of mouth, that is called as mandibular depression. Closing of mouth, that is called as mandibular elevation, and making the chin forward, called as jutting the chin forward. So the word you can use as jutting the chin forward as mandibular protrusion, and reverse back, that is the sliding the teeth backward. We will call it as mandibular retrusion, and also sliding the teeth to either side, that is called as lateral deviation of the mandible. These are the motions occurred in the temporomandibular joint by the combinations of rotation and gliding in the upper and lower joints. Rotation in the upper and lower joints. So here the functional movements of the mandible are obtained by the combinations of intra-articular movements, and which are controlled by the delicate interplay of many muscles, and the functions that the temporomandibular joint support are chewing, talking, and swallowing. So the movements and the functional movements which are occurring in the temporomandibular joint, or I have mentioned above here. And to understand the joint kinematics, you should know both osteokinematic as well as arthrokinematic movements which are required for normal function of the temporomandibular joints. So this mandibular depression, opening of mouth, and protrusion, retrusion, and the lateral deviation are all those movements or osteokinematic movements. Here we can see the lever is how it is moving. That mandible here, the mandible, how it is moving. It is moving down, it is called as depression. Moving up, it is called as elevation. Side to side is called as lateral deviation. Forward and backward movements of the mandible. All these are the osteokinematic movements. And coming to the arthrokinematics, so here arthrokinematic movements involve rolling and gliding, and also distraction and lateral glides which are taking place inside the temporomandibular joint, inside the articular surfaces. That comes under arthrokinematics. We are going to discuss simultaneously what happens during mandibular elevation and depression, protrusion and retrusion, what is happening inside the joint, that is whether it is rolling or gliding. So if it is rolling, where, on which part it is rolling, or any other part which is rolling on another part, like that we are going to discuss in this joint kinematics. Now the first one is the mandibular elevation and depression movements. Now first we are going to see the depression, that is the opening of a mouth. So these two movements occur simultaneously. So the movements which are taking place in the opening, that is the mandibular depression. In the elevation, the movements which are taking place is quite opposite to that of the depression movement. So now we are going to see first this mandibular depression here, that is the opening of mouth. Okay, So so we are having 4 joints on both the sides, isn't it? Now how it is going to occur in all these parts? So the motion at each temporomandibular joint follows a similar pattern. So whatever the movement is taking place in right side, the same movement is taking place on the left side also. Okay, during opening of mouth, that is called depression, and closing of mouth, that is called elevation. Okay, now we will see during opening of mouth, the first portion of the motion is done by the anterior rotation of the condyle on the disc. So here the condyle is rotating on the disc. So the first portion during opening of mouth is done by anterior rotation of the condyle on the disc. Okay, this motion is occurred in the lower joint. Okay, and lower joint means in between the inferior surface of the disc and the anterior portion of the mandibular condyle. Okay, so the normal opening of the mouth is 40 to 50 millimeters. According to some investigators, they have mentioned that the normal opening of the mouth is 40 to 50 millimeters. But the motion which is occurring in the during opening of the mouth, that is the first portion of the motion, which is done by this anterior rotation of the condyle on the disc, is the first portion of opening of mouth, which accounts for 11 millimeters to 25 millimeters of opening. So the first portion accounts 11 millimeters to 25 millimeters of opening. Okay, then the position at the end of rotation phase. So some part it has been rotated. Okay, the position at the end of rotation phase can be described as posterior rotation of the disc on the condyle. Posterior rotation of the disc on the condyle, or anterior rotation of condyle on the disc. Okay, so both are same. You can mention it in both the ways. So again we will see during opening of the mouth, the first portion of the motion is done by anterior rotation of the condyle on the disc. It accounts for 11 millimeters to 25 millimeters of the opening. So the position at the end of the rotation phase can also be described as, so if this one is stable but it is rotating here, simultaneously the disc is rotating posteriorly. Okay, so that is called as anterior rotation of the disc, and also which causes posterior rotation of the disc on the condyle. Posterior rotation of the disc on the condyle. Okay, so anterior rotation of the condyle on the disc, or posterior rotation of the disc on the condyle, and also we can call it as anterior rotation of the condyle on the disc. So whatever the terms and the terminologies and the literature used here is, the thing happened is the rotation of the condyle, mandibular condyle anteriorly, which causes the opening of the mouth up to 11 millimeters to 25 millimeters. It is taking up, the such movements are taking in the lower joint. Such movements are taking in the lower joint. So here you have to explain here how condyle is moving on the disc, and also disc is moving on the condyle. Both the things you have to explain. Okay, now coming to the second portion. So coming to the second portion, here after what you call as after rotation, the second portion of the opening occurs. The second portion of the opening involves translation of the disc and the condyle complex, both disc and the condyle complex anteriorly. So this complex moves anteriorly and inferiorly, along the articular eminence. So if you can see here, during rotation here, so there is no increase in space on the posterior aspect, isn't it? So in the next phase of opening, what is happening here is, so this complex, this articular disc as well as the condyle complex after rotation, so this will cause some translation, that means forward movement, translation, and this complex moves inferiorly, it moves front, that means it moves front and inferiorly, moves front and inferiorly, causes still the remaining portion of the opening of the mouth. Okay, so this is happening, and here if you can see here, the space in the posterior side is increased during the forward translation of the condyle anteriorly. Here the movement is taking place here is in the upper joint. The movement is taking place in the upper joint. Okay, so this is the kinematics, arthrokinematics and the osteokinematics taking place inside the temporomandibular joint. How this arthrokinematics are taking place inside the joint. So this is the first phase of opening of mouth, and this is the second phase of opening of the mouth. The first phase of opening of the mouth occurs in the lower joint, where there is an anterior rotation of the mandibular condyle on the disc, or posterior rotation of the disc on the condyle is taking place. At this level, only 11 millimeters of opening of mouth occurs. 11 millimeters to 25 millimeters of opening of mouth is occurring at this first phase. In the second phase, the complex of this articular disc and the condyle, which translates forward and glides inferiorly along the articular eminence, causes the remainder opening of the mouth. Okay, up to 40 to 50 millimeters. So this is the second stage. You can see the space on the posterior aspect increases. Okay, so this is about the kinematics of the opening of mouth. So in elevation, now we have seen the depression. In elevation, what happens? In elevation, so again it has to come to its normal position. So then what happens in the case of elevation? The reverse motions takes place. First, it translates posteriorly and superiorly. So already it is forward and inferiorly. So it moves superiorly and translates posteriorly, and then the condyle rotates posteriorly on the disc, and the disc rotates anteriorly on the condyle is taking place during elevation. To check whether the opening of mouth is normal or not means, put your two fingers proximal interphalangeal joints in your mouth. If it fits easily, then it is a normal function. Up to 3 fingers also it is considered as normal opening. You should keep it in between your incisors, that means central incisors. So you can put your 3 fingers in your mouth in between the central incisors. If 2 fingers are fit easily, then it is normal, and 3 fingers also it is normal. If it is not fitting properly, the 2 fingers is not fitting properly, that means your opening of mouth is decreased. Okay, so this is about the mandibular elevation and the depression. So, and also here we have to know how the control of disc is happening. So it is, the disc is present in between these articular surfaces, and the control of disc is very important during a rotation and gliding. Okay, how it is going to occur, now we will see. So here the control of disc during this mandibular elevation and the depression is done by two ways. One is active control and the passive control. So passive control occurs through the capsulo-ligamentous attachments on the disc. So as we know that the disc is attached anteriorly and posteriorly with the capsule, and to the medial and lateral poles of the condyle the disc is attached, you know that. Okay, now the lateral pterygoid muscle, in that only superior lateral and inferior lateral pterygoid muscle. So the anterior aspect of the disc is attached to the capsule and the superior tendon of the superior lateral pterygoid muscle. So this produces, the lateral pterygoid muscle attaches to the anterior portion of the disc, producing active control, and the other two muscle segments which maintaining the disc position during active movement. So this muscle also, the inferior lateral pterygoid muscle also helps in maintaining the position of the disc during active movement, Okay, now the other attachment which is present on the posterior aspect is it is attached to the posterior capsule. In between them it is having the laminae, retrodiscal pad. This is also helps in the maintenance of articular disc during opening and the closing of the mouth. Okay, so passive control occurs during passive control occurs through the capsulo-ligamentous attachments. Okay, and the active control of the disc is exerted through muscular forces, that to superior portion of the lateral pterygoid muscle, and other muscles which assist for this active control, or one is the inferior lateral pterygoid muscle, and also the masseter muscle is also helping. Masseter muscle is also helping in the control of the disc during movements. Now we will see how it is happening. Here, during the rotation, we have seen that only 11 millimeters of opening of mouth is taking place, and further the translation movement, during the translation movement, the phase of opening, that is the biconcave shape of the disc, and also with the condyle will translate anteriorly as well as inferiorly. So what is happening here? See, here it is gliding here. So then what happens? So the attachments which are present on the posterior aspect, so here the superior lamina stretches, here and helps in the translation of the anterior disc, whereas the inferior lamina, so here in the apic you can see, during still rotation it is still attached to the neck of the condyle. Now here in this pic, so after translation what is happening? So the superior lamina helps in the gliding, but this inferior lamina, so here the space is increasing here and it acts as a tether. And limits the forward translation, anterior translation, and it limits the anterior translation. Okay, so this one is limiting the disc not to move anteriorly. So this is a passive control and this one is a passive control. And if again it moves back, so articular disc is moving posteriorly, so the posterior translation is limited by the anterior capsule and the superior lateral pterygoid muscle. So capsule is passive control and by this muscle is active control, and the two other muscles is the masseter muscle helps to overcome the medial pull of the anteromedially attached lateral pterygoid. So the masseter which is present on the lateral aspect, which helps to overcome the medial pull of the anteromedially attached lateral pterygoid. So this is the thing happening and how the control of disc is taking place here. Okay, so this is about the mandibular elevation and a depression is done in the temporomandibular joint. So the control of disc is mainly done by two methods. One is active control and the passive control. So the passive control is done by the capsules and the ligaments attached to it, and the active control is done by the contractions of the muscles which surrounds the temporomandibular joint. Okay, so this is about the mandibular elevation and depression movement joint kinematics. In the next session we are going to see mandibular protrusion and retrusion, and also the mandibular lateral deviation or lateral excursion. Thank you.